The winner of the Queensland Nurses and Midwives Union Positive Practice Environment Champion Award is Chris Dawber.
My name's Chris Dawber and I'm a clinical nurse consultant. I work in an area of nursing called Consultation Liaison Psychiatry and Addiction Services. We basically provide advice, guidance, support to nurses, doctors and allied health in the general hospital system that are working with people that have mental health issues or addiction issues. But the other part of my job is to work with the staff and to look at the mental health needs of our staff and to support them as they deal with, particularly nurses, the emotional labour that's associated with their job. So I see that as a big part of our work. One of the main things that I've been working on over the last 15 years is developing a reflective practice group program for nurses. For me, that's creating a little space where nurses can come as a group and share some of that burden of emotional labour, to support each other, to learn from each other. That this is important for nurses to be able to process this in some way, because they're bound by confidentiality and they can't always go home and talk to family or friends, and there are people, sometimes nurses, who may not even have those available. I think that nurses and midwives who work in a good team setting and have a healthy culture of support can really flourish and develop this craft or this art of what they do. There was an old saying that used to be around from the hierarchical days of nursing, the nurses eat their young. And there was this sense that for many young nurses coming into the profession that there wasn't a lot of support. So I think for us to be able to develop this sense of caring and compassion for our patients, it's essential that we apply the same principles to our colleagues in our workplace. And I really believe that, there's an onus, a responsibility on us to try and look at ways of supporting, acknowledging and validating those we work with.